Okay, so Avor, with your personal circumstance, you must have had to rewrite your slide deck in the last couple of weeks, did you?
Well, to tell the story doesn't really change because I'm doing what I set out to do. But what I realized is that people need a voice and people need a support. I'm in healthcare, and many of you who are in healthcare, you are that person for your family. You're the person that everyone goes to have a conversation. You're that person that everyone goes to ask questions about healthcare and help call the doctor or call the hospital. But the reality is that everyone doesn't have those resources. We talk about social determinants of health now like it's a novelty. But for someone who's been doing that work for 20 years, it's not. There are people who don't have a person within the healthcare system. And what our health assistants are is that person over time and for a relationship. And we use data and we use machine learning, which I didn't get a chance to talk to you about, to actually help them navigate through the healthcare system, to provide them the information that they need to work with the physicians, to work with the healthcare system, to get the things and get the needs that they have for their best outcomes. So,
thank you.
I saw.
Yeah. Anyone here how many people are that person for their family? Okay, yeah, quite a few of you. And we had a question. Is that right?
Yeah,
Jessica, could you?
Dr.
We'll just
Lawrence,
talk.
Yep,
That's
fine. The role of that assistant sounds sort of overwhelming. It sounds like they're the social worker, the confidant, the everything. How do you constrain their role so that it's realistic for them? And how do you define that?
Sure.
Yeah.
And as I mentioned, they have a whole team that works with them. So a health assistant is a lay health worker that's trained. What Accolade does is they become the number on the back of the insurance card. And what those health assistants do is they probe to ask the difficult questions that people don't ask when they call in, just to say, I'm looking for a doctor, because there's a reason that people are looking for a doctor. And what we do with our health assistants is they work with nurses, they work with behavioral health specialists, they work with pharmacists to help people navigate the healthcare system. And what happens is oftentimes there'll be a question that moves from a question just about their benefits to what the health assistant recognizes is a medical issue. And then they do what's called a warm transfer to the nurse. And so the health assistant and the nurse are both on the same data system. So all the information that the health assistants gained about that person is now also available to the nurse. And then they send that person and they have that person then enhance and discuss with a nurse. If it's a behavioral health issue, then they enhance them to a behavioral health specialist. The other thing that we do that's amazing with technology, and this just happened recently, we literally had somebody call us on their break. They called their health assistant on their break, but then they were suicidal. And then they got off the phone, and we couldn't get them on the phone anymore. But we were able to get them through our mobile messenger. And they were texting back and forth with us because their break was gone and they couldn't use their phone on their job. And their conversation escalated on mobile. And we actually said, you know what, we are really concerned about you, because the behavioral health specialist was now engaged, the nurse is engaged, our physicians are engaged. And we said, we're calling 911 and sending them to your work, because our database also had the address of that person's place of employment in the system. And we sent 911 to that person's workspace, and they voluntarily went with them to be hospitalized. These things literally, the combination between that relationship between the person and that connection with data and technology literally saved someone's life that day. And a chatbot, no offense, can't do that.
Excellent question. Can a chatbot do that?
As I mentioned, you basically created a case for a chatbot, and the thing the chatbot can do, the initial phone call, if people can't make it, it could be chatbot. The messenger that you mentioned is a chatbot. And within a chatbot, as I mentioned, escalations are very important. So it's not like chatbot is self-running thing. So at any point of time, call can be escalated to live assistant, to phone call, to emergency. It's just a matter of how neural network is trained, and at any point of time, patients should be able to say, I need to talk right away. But we can also look at the patterns, and that's the advantage of using neural networks in combination with conversational thing. It's just how you initiate the first interaction, what type of neural networks you can use to identify and escalate certain things. And behind the scenes, we have also big data analytics integrated with neural networks that even if patients don't indicate I am suicidal, there are ways of actually predicting behavioral things and escalating behind the scenes to caregivers or nurses if we see certain patterns that are indicative of certain health issues. Yeah.
And thanks, Tatiana. Sorry, but I've got to get to these guys as well. We've got to keep things moving. So, guys, yeah, we can people talk to these guys later after the talks if you've got more questions and everything. So, guys, how many people are actually using what you've built?
So our first stage of the study was in the clinic here, and so a clinic at Stanford and Palo Alto VA. So we had 180 enrolled in that time period. But we're staging our enrollment to make sure everything's validated along the way.
Mm-hmm. Okay, and what are the next steps?
So we did the in-clinic supervised study. So this is where patients would come into the clinic, they would get their vascular testing, and then they would use our study app. And so we're trying to correlate that. So now the next step is to now do this outside of the clinic. So patients will now go home and use this on their own and be able to validate that next step of remote monitoring.
Excellent, thank you.
Yeah.
Thank you. And I'm sorry, but we don't have any time for audience questions because otherwise you guys are going to miss your next break. So thank you very much, and thank you, everyone. We'll move on to the next presenter.